The station that makes you feel good. UK Health Radio. The station that makes you feel good.
I'm your host, Dr. Vijay, Murthy, and I'm with Professor George Lewith, who is the Health Research Professor at the Department of Primary Care, University of Southampton, who has had a long career as a medical practitioner since 1974, has written several books, have contributed to more than 350 peer-reviewed articles in research. So I'm very, very fortunate, George, that you have agreed to talk to me today about how to choose a practitioner.
Well, that's very kind of you, Vijay. I hope our discussion isn't going to offend anybody, but having practiced both in the NHS and privately,
yes,
and having had a clinical practice for almost 40 years till I retired from clinical practice and became much more focused on research, having run the two in parallel for many years, I hope that I can give you your listeners some useful advice.
Yeah, I don't think, you're going to offend anyone. In fact, you are going to hugely help the consumer or the patient or the client, and also practitioners themselves, because you will have a very good message for both practitioners and clients.
That's quite a thing to live up to. I hope I can do it for you.
Okay, George. When it comes to choosing a practitioner, I'm just kind of assuming I'm a patient.
Yes.
Say I'm diagnosed with a condition, say like Hashimoto's or cancer, or it could be that I don't want to take statins. So if these are the situations, if someone is considering complementary medicine practitioners, what should they be looking for in terms of taking a decision on who to choose?
Well, I spent a lot of my time practicing what I'd like to think of as integrated medicine. And always my first consultation was centred around what the patient wanted,
mm-hmm,
and what the evidence was for their condition, and experience, and my experience of their condition from both the conventional and the complementary viewpoint, to try and help them decide what the best choice was for them. And the choice for one person is often very different to the choice from another.
Yes.
And whether they wanted to try something, for instance, if you have a slightly raised cholesterol, that's a good example.
Mm-hmm.
Probably raised cholesterol is a self-inflicted lifestyle issue.
Can you tell me a little bit more about it?
Well, if we were all a stone thinner, or 2 stone thinner,
yeah,
and probably that applies to me as well, we did a little bit more exercise. I try and do quite a lot of exercise every day, but if we did a little bit more exercise than the average in the UK, because all the government figures tell us that we're not doing enough, we're not doing our 1,000 steps on our iPhones every day,
yeah,
or 10,000 steps.
10,000 steps.
10,000 steps on our iPhones every day, then we would probably solve our own cholesterol problems.
Mm-hmm.
That's the first issue. The second issue is that there's been a huge debate in conventional medicine about whether it's really worth taking statins.
Yeah.
So there are some people who, conventional doctors, have no interest in complementary medicine at all, who say, well, the evidence for long-term statin use isn't quite as good as we first thought in terms of preventing heart attacks and preventing strokes and preventing generally circulatory illness. Because what happens, let's go back to what actually happens with high cholesterol, high fats in the blood. They appear to act in an inflammatory way and damage and deposit in the arteries.
Yeah.
That deposition in the artery wall narrows the artery wall, and it makes the artery wall more fragile. So the chances of a narrowed artery wall and blood not getting to the heart is higher. The chances of a stroke where the artery wall breaks in the brain and causes a stroke is higher. The chances of less blood circulating to your legs, so you get peripheral vascular disease, your foot starts going black, is higher. So that's what we're looking at, that disease process. If we started by better self-management and made sure that we walked and didn't eat too much fat and had a healthier lifestyle, we probably wouldn't need it. But we don't in the West. We have a very sedentary lifestyle, and that doesn't happen. If we have high cholesterols, and we take that as an assumption, then what's the evidence for statins? And there are divided opinions. For instance, people like James Lefanu in The Telegraph takes a view that this probably isn't as good as many people think it is, and he's backed up by some very eminent cardiologists and other professors who look at evidence. There are other people who take the view that statins are absolutely essential. So even when we look at the data around statins, that's divided. There's some people who take issue with what the majority of conventional doctors think. Very often the GP doesn't know the details of that debate. So, for instance, if we take cholesterol as an example, somebody might come and consult me and say, should I take statins, shouldn't I take statins? Now, the decision you make there is based on the evidence that you have conventionally, what you think you can do unconventionally. So if we take the very big picture, if somebody comes in, they're overweight, most of us are a stone or two overweight, particularly by the time we get to middle-aged, me included, then really what you've got to think about is what are the lifestyle things that individual can do that they're not doing to make their health better. And the high cholesterol is probably just a reflection of their overall health. So they probably spend too much time sitting, they probably don't do their 10,000 steps a day, they probably eat too much fatty food, perhaps too much cheese, too much ice cream with sugar. So the first thing that they can do to bring their mildly raised cholesterol down is to begin to think about how they eat and what they eat. So they can begin to think about taking more fish oils. They can begin to think about eating less hard fat like meat and cheese, taking more exercise. Now, probably that alone might obviate the need, may reduce the need for them to have to take statins.
To get that kind of right information, George, can the person make a decision on their own, or will the GP be able to help them? Should they see a complementary medicine practitioner?
The GPs in the UK very often will give that advice and will be very prone to prescribe statins because that's in the recommended guidelines. They may well tell a patient in that situation to go away for 6 to 9 months, see if they can put things right themselves before they make a lifelong prescription. Because like all drugs, statin comes with side effects. For instance, lots of muscular pains. There's some quite well written up adverse reactions to many of the statins. So I think a good GP will do that. A rushed GP, and many of them are rushed and under lots of pressure at the moment because of patient demand, may just prescribe the statin. But really this information is available very widely, and this isn't uncommon information I'm talking about. You dial into any health site on the web and you'll find the same information. So the first situation is, how bad is it? Is it potentially reversible? If it's, for instance, something that's inborn, it's a genetic predisposition, statins may be a very good option. If it's a lifestyle illness, looking after yourself may be a very good option.
Yeah.
But that very much depends on the individual, so you make the individual choice about that, and you sit down and counsel the patient. If their cholesterol is still raised, particularly if they're low density, the nasty inflammatory cholesterol is still raised, then that's likely to damage the arteries, cause them to narrow, have a much greater chance of leading to a heart attack or thinning of the artery, which has a much greater chance of leading to a stroke. So you probably want to do something. Yeah. There are a variety of herbal remedies that have reasonably good preliminary evidence that they will reduce cholesterol. For instance, red yeast ferment contains very similar chemicals to statins. In fact, statins were derived from a red yeast fermentation product.
Right. Yeah.
So what you can do is you can take a milder form of statin as a yeast product, and that may well work.
Yeah.
Perhaps in the end, the balance of evidence is to take the statin from the conventional point of view. Mm-hmm. But if your readers look at the debates around statins, they will find doctors are divided. Conventional doctors are divided.
Yeah.
There are some who think the evidence is relatively poor in relation to taking statins, and we've misinterpreted the outcomes. And there are some who will think statins are the best thing since sliced bread.
Right.
So while there's a lot of data out there, and statins are in the guidelines for the treatment of raised cholesterol, there's still really good, constructive, evidence-based debate about how valuable they really are. Yeah. We don't have the complete picture yet.
Yeah.
So what you need to do is really talk to somebody, give them the appropriate advice, and allow them to make an informed decision. And that kind of freedom isn't always possible for a GP in a 10-minute consultation.
That's right. Yeah.
It's just not an attainable goal for many people, and very often the GP won't have the skills to make another recommendation other than a lifestyle change. So it might be worth seeing a responsible nutritional or herbal practitioner about that kind of process.
Yeah. So obviously, these have long-term implications on health.
They do.
And therefore you can't take a decision very lightly, and you can't experiment with yourself, if I'm talking about a patient.
I think you can experiment with yourself in the short term. For instance, if your cholesterol was 6.5 or 7, and you chose to take a really dedicated lifestyle intervention over 6 or 9 months, then I think that's a very reasonable choice.
Yes, yeah.
I think if you're talking about taking a lifestyle intervention and never measuring your cholesterol again, and never thinking about it again, and then after 6 months putting the weight back on because you've lapsed and decided you're not going to take the statins anyway, well, that's plainly fairly stupid.
That's right. Yeah. So, there are quite a few variables to be considered.
There are.
And George, a condition like, say, Hashimoto's, which is an autoimmune condition that affects the thyroid glands, and it can present itself as hyperthyroidism or as hypothyroidism.
Yeah.
And sometimes, patients who have been on thyroxine for a long period of time, they decide that actually they don't want to be on thyroxine for the rest of their life, and say they are in a hypothyroid situation at that particular point in time, and they explore complementary medicine practitioners. How should they really find one who is suitable to help them with?
Well, with thyroid disease, irrelevant of whether it's Hashimoto's or another thyroid disease, if the thyroid gland is not producing thyroxine, then the person needs thyroxine. And if they don't have thyroxine, they're quite likely to become very seriously ill. That hormone lack will cause all sorts of secondary changes in the body which would seriously compromise their long-term life expectation.
Yeah.
So without going into any details, that probably isn't a very clever choice. In that situation, conventional medicine has a very sensible, completely safe, completely curative intervention,
Yeah.
and the body, particularly from Hashimoto's disease, the thyroid gland has been killed off. It's never going to heal. You're not suddenly going to find a way to produce natural thyroxine. You need a conventional doctor.
Yeah.
And you need to have your thyroid levels monitored. Now, if you want to do other things that involve integrating some complementary medicine into the way you manage yourself, then it's pretty essential that you pick a practitioner who is dual qualified. Somebody who has a conventional medical qualification and enough skill to reasonably help you manage your conventional medicine, but can also make useful suggestions about what complementary medicine you might use to help whatever problem you have.
Yes.
Now, that could be a conventional doctor who has a sympathy towards complementary medicine, some understanding, and can help you with referrals, or it could be somebody who has skills in both conventional and complementary medicine, like you, Vijay.
Yes, yes. So it is important to understand that for different health conditions, the choice that you make in terms of which practitioners to see needs a bit of research.
Yes.
You can't just simply go by your belief and say, okay, I'm going to give up this and I'm going to start doing something else.
Yes. I mean, in the case of thyroid disease, that would be an example of somebody who would make a very foolish choice if they chose to give up their thyroxine.
Yeah.
Equally, in the case of an insulin-dependent diabetic,
Yes.
somebody who was a thin young man or woman who was diagnosed as a type 1 diabetes at 12, 13, 14, because it very often happens as a young child.
Yes.
Choosing not to take your insulin is a pretty stupid thing to do.
Absolutely. Yeah.
It's likely to quite quickly result in you becoming terminally ill.
Yes. Yeah. So whereas that's different if somebody has type 2 diabetes and has just been introduced to insulin, then you...
Well, that depends on the type 2 diabetes. The type 2 diabetes can be divided basically into the ones who need insulin and the ones who don't.
Yeah.
If you're a non-insulin dependent diabetic, most type 2 diabetes will get very, very much better with better lifestyle management. Better diet, possibly missing out carbohydrates, making sure the diet is balanced, has more protein, more fruit. You have a good look at their nutritional supplementation. Above all else, you get them to lose weight. Not all type 2 diabetes are obese, but the majority are, or overweight anyway. And you can probably do a lot of lifestyle things, including exercise, which will help them self-manage. So it may be possible for an early type 2 diabetes patient to reverse their illness. If they're an insulin-dependent type 2 diabetes, then that may be much more difficult. And it needs careful control.
So George, how would one know that they are now needing insulin when, say, they were on metformin or oral
Well, that would depend on
antidiabetic?
Well, that's a very conventional question.
Yeah.
And that depends on the way the GP and if a consultant diabetic specialist is involved, how they manage the patient.
Yes.
So if you have a diabetic, you're looking at them and working with them, and you're following them up regularly.
Yes.
Every 6 months, every 3 months, every 9 months, depending on how stable they are.
Yeah.
You don't just leave a diabetic to go away and get on with it themselves, or you shouldn't.
Yes.
So you'll be looking at various blood markers like HbA1c, you'll be looking at their sugar levels, you'll be looking at their weight, at their blood pressure, they'll be having checks on their eyes, they'll be having checks on their circulation and on their feet for all sorts of different complicated reasons. So diabetics need proper follow-up,
Yes.
they need proper management, and there needs to be a discussion with the diabetic patient as to when or if they need a change in their medicines, and insulin is one of the options.
Yeah. So this is where integrative approach is extremely important, because the patient would need to have access to a conventional medical practitioner, as well as to make changes to their diet or lifestyle where the conventional medical practitioner is not able to advise, or doesn't have the time or doesn't have the skills of the training to actually see a complementary medicine practitioner.
Yes, the evidence is, particularly some of the Danish work, the evidence is that if you use a combination of conventional and complementary medicine, for instance, you use a good balance of nutritional supplements, and you maybe also use some herbal medicines, some of which have good preliminary evidence that they may well help type 2 diabetes, then there is evidence that you're very likely to get better control by using both. And you may be able to avoid some, potentially, maybe quite a lot of, your conventional medicine. If you're going to do that as a patient, then the responsible advice is to make sure that there is good communication between your GP or diabetologist and the complementary practitioner, that both know what each other are doing.
Yes.
They have your patient interests at the centre of their concern, and it's not a battle between one type of medicine and another. That's completely pointless.
That's right. Yeah. So it has to be patient-centred.
Yes. It's essential.
Yeah. And, like the UK, in many other countries around the world, not all systems of or health models or modalities are statutorily regulated. Some are voluntarily regulated, some are unregulated. So as a consumer, what should one be looking at in terms of choosing the right kind of practitioner for them?
Well, yeah, it's a very good question. I mean, 20 or 30 years ago, almost all complementary medicine was unregulated.
Right.
In the UK. So we had people going to private courses to learn acupuncture.
Yes.
And then they became what might usefully be called lay acupuncturists, or perhaps better, professional acupuncturists. They weren't doctors, they weren't physiotherapists, they weren't nurses. They were just practicing acupuncture. And they were members of a particular acupuncture society. Yeah. Now, that began to change very rapidly after the 2000 House of Lords report on regulation of complementary therapies.
Yes.
And a whole series of things happened. And so the vast majority of the major professions in what is loosely called complementary medicine are now either statutorily or voluntarily regulated.
Yes.
For instance, the chiropractors and the osteopaths have a statutory regulation, rather like doctors, nurses and physiotherapists.
Yes.
It's the same kind of regulation.
Yeah.
There are many other professions that may be involved, for instance, in acupuncture, where there's a voluntary regulation.
Yeah.
There's a voluntary regulation for nutritional practitioners as well.
Yeah.
So that they jointly, as a group, come together and they have a code of ethics. They have appropriate professional insurance and professional indemnity. And they therefore have a process through which they train, which is recognised, open and transparent. They have a process of insurance, a process of regulation, and a process of postgraduate training, continual updating.
Yes. Yeah.
Now that's very easy to find out about on the web. The Council for Natural Healthcare, the CNHC.
Yes.
I'm involved with them. I'm on their board, and they are a voluntary regulator.
Right.
And they themselves are regulated by the PSA.
What's PSA?
Now you've got me. The Professional Standards Authority.
Right.
And the PSA is the regulator of all regulators in the UK. Okay. It runs the GMC, the General Medical Council, the General Dental Council, the Nursing Council. So the PSA regulates these people. The Professional Standards Authority regulates many complementary practitioners on a voluntary basis. If they volunteer to join the CNHC, they then have certain basic requirements like ethics, indemnity, professional standards, continuing education, and you know what standard these people are.
Yeah. So can you give some examples of modalities who have been under that regulation?
Yes, for instance, acupuncture, as I've already mentioned.
Yes.
Hypnotherapy.
Yeah.
Nutritional medicine.
Mm-hmm.
Various offshoots of acupuncture like shiatsu.
Yeah.
Reflexology.
Mm-hmm.
Aromatherapy.
Yeah.
So those are quite big areas of practice in the UK which are regulated in a proper, formal way.
Yeah. Okay. So I'm going to ask you a question which I think can be controversial. Is quite a few people who choose complementary medicine practitioners or alternative medicine practitioners, they do it because they may not believe in the philosophy of conventional healthcare. So they may not really pay attention to the educational qualification or training of the complementary medicine practitioner. They might go by their skills, or they might find a practitioner charismatic, or they might actually think that they bring something which is based on their experience and skills. What are the pros and cons of this?
Well, that's a very difficult question, because some charismatic self-promotional practitioners are absolutely excellent as practitioners.
Right.
And they're responsible, and while they may not be regulated, they may have a lot to offer that individual patient.
Uh-huh.
Some practitioners who fall into that, and remember, 20 years ago, that was the common position for many people practicing complementary medicine.
Yes, that's not too long ago, actually. 20 years.
That's fairly recent.
Yeah.
Equally, people who nowadays choose not to be regulated,
mm-hmm.
and it is a choice for most of the majority of complementary medicine in the United Kingdom, are probably a bit one-off.
Mm-hmm.
And some of them may be a bit flaky. And it's very difficult for the individual to make a real choice.
Yeah.
Because there's often not enough information.
Yeah.
One of the things about a non-regulated practitioner, which I think is dangerous, is that most human beings are prone to make mistakes.
Yeah.
It's not always their fault, but we're not completely hardwired. It's a bit like most computer software. It's not perfect.
Yes.
Thank God cars are more perfect than the computer software on our laptops, or we'd have a lot of deaths. But on the roads, suddenly breaking down in the middle of a traffic jam wouldn't be very clever. However, in a sense, people who don't want regulation in the present environment, who don't have some form of regulation and professional indemnity, would worry me, because if they did make a mistake, there would be no way that they could be protected or you could be protected.
Yeah.
So I think things have changed in the last 2 or 3 decades,
yeah.
and I think that would be a cause of worry. The other thing that would be a cause of worry for me about the unregulated practitioner was they wouldn't be necessarily buying into a well-described, transparent set of ethics
uh-huh.
about patient data, patient confidentiality, and all the other things.
Yes.
Now, it may be that they're not regulated through the CNHC, it may be they're regulated through their own professional society.
That's right.
But there needs to... I would worry about a practitioner who was not regulated.
That's right. So what would be your advice or general guidelines for a consumer? They go online and look for a particular modality, and then they come up with a list of these practitioners.
Yes.
So what are the main things that a consumer should be looking at before they make a decision about whether to see this practitioner or not?
Well, I think the first thing they need to know is that the practitioner is appropriately trained and skilled.
can you explain a little bit what's appropriately trained?
Okay, let's take acupuncture for an example, and we can also take a profession that largely self-regulates as comparison, Alexander technique.
Yes.
Now, acupuncture is usually a 3-year course, very often a full-time course, not always, but usually a 3-year course. Gone are the days when a regulated acupuncture practitioner or an acupuncture practitioner could legitimately do a weekend course and then put their plate up and go into practice. Yeah. That could happen 30 years ago. It can't really happen now. Or it shouldn't really happen now. If they're a member of the British Acupuncture Council, then the British Acupuncture Council will have looked at their qualifications, will have seen that they have had a reasonable amount of training. They will then pay the British Acupuncture Council a certain amount of money. I don't know what it is, but some years ago it was about £500 a year. So it's not a small sum. It's not massive, but it's not a small sum. And they would be required to do a certain amount of continued professional development. They'd have a code of ethics that they abide by, which would be on the British Acupuncture Council website. And they'd have professional indemnity. So that's and the British Acupuncture Council is regulated by the Professional Standards Authority, the PSA. So a person would have confidence that they were seeing somebody who was properly trained, who understood patient confidentiality, who kept proper records, who had good ethical guidelines, and who was in a process of continual professional development. Now, that happens through the PSA. As far as I know, the Alexander teachers, who I think do a fantastic job, we've done some clinical trials on Alexander in back pain, and they demonstrate that these people, a properly trained Alexander teacher is quite likely to help your back pain. I think they're very well trained. They have a pretty rigorous 3 or 4 year course, I can't remember, but they've chosen as a profession, as Alexander teachers, to self-regulate. So you'd go on the Alexander site, the Alexander teaching site, and you'd look at their qualifications, their ethics, their indemnity, their professional training, and you'd make sure that your practitioner was a registered, trained Alexander teacher. Even if they weren't regulated by the Professional Standards Authority, and then you'd think about going to see them. So that's the most important first step. Is this a proper person? If you're going to see somebody who doesn't fulfill any of those criteria, that's a little bit of a worry to me.
Yes, you're at risk.
I think you're at risk. They may be very good. But you're at risk. And interestingly, they're at risk as well. Because if they make a mistake, you can sue them and they have no cover.
That's right. And, George, in your experience, I'm not talking about, what's the evidence for certain modalities being helpful in certain conditions. But say you're not a researcher for a minute and you are a human being like anyone else.
I hope I am too.
and that you're not a medical professional. Let's imagine. And you were to, in your experience, because you have been around the block for a very long time and you have seen all different kinds of practices and practitioners, for the benefit of our listeners, which health conditions or for which health goals would some of these complementary modalities be more suited? Would you be able to comment on that?
Well, that's a huge question.
I know. I mean, it's a very difficult question.
It's an almost impossible question to answer. I think what we find... Let's go back to the consultation.
Yes.
What complementary practitioners usually do in the model of illness they espouse, which can be traditional Chinese medicine, it can be homeopathy, it can be acupuncture, it can be Alexander technique. The bottom line is they will work with you to develop an individualized approach to your problem or to health maintenance in general, and they will develop for you a process that's appropriate and enabling. So in other words, they will almost universally ask you to take some responsibility for your illness or your problem and explain how you can best do that within a particular therapy.
Yeah.
Now that's something that conventional medicine does less well, much less well.
Mm-hmm.
And if we look across the board at the feedback from patients who go and see complementary medicine, that is pretty much the key issue that they value, that the practitioner help them understand their illness and take control of it.
So it's a participatory model.
Yes.
They both participate.
Yes. It's a participatory model which isn't confounded by lots of Latin and Greek and medical jargon.
Right.
So that's really a really important step.
Yeah.
And that can be applied across a whole range of problems.
Right.
It can be applied from taking a herbal medicine for an acute infection
Mm-hmm.
to terminal management of cancer.
Right.
And all the lifestyle diseases like obesity, cardiovascular disease, in the middle. It can also be applied to depression, where we're now beginning to realise that the overprescription of antidepressants may not be a very constructive thing to do.
Why? Why is that?
Because they tend not to work in the long term. And sometimes for mild depression, which really is human distress, for instance, a bereavement or a divorce,
Yeah.
it may be much better not to take an antidepressant and to work it through. That's a very difficult clinical judgment because we're very poor at predicting suicide, which is not a great event. And the largest cause of male death under the age of 50 is suicide.
Mm-hmm.
So that's said in the context of you need to be seeking medical help if you're very depressed.
Yes.
But the long-term prescription of antidepressants is quite possibly not a very good idea, and there are a lot of people in this country on long-term antidepressants, and they're rather fearful of coming off them.
Yes.
So I think these are complicated issues. I think that the process of complementary medicine is very often about self-empowerment
Yeah.
and individualization.
Yes.
And I think taking responsibility for your health and doing some simple things that improve the quality of your life are vital things that complementary medicine can do in parallel with conventional medicine.
So what I hear from you, George, is that the person who decides to use complementary medicine or take an integrative approach has to be committed to this process.
Yes, but rationally committed. It's not just a question of belief. It's not just a question of believing, delusionally believing, that you can give up your thyroxine or your insulin. That's a dangerous delusion. It's about having a balanced, critical view of what your health problem is, or your health maintenance program is,
Yeah.
and how you as an individual can best fulfill that.
Yeah, I mean, that's a very, very important point. Can you give more examples of how? Of course, belief is what leads to commitment and an ability to take action and to change one's behavior. However, a delusional belief can lead to disaster.
Yes.
Can you give some more examples of, possibly in your experience, how people actually can base their choices on delusional beliefs about complementary medicine?
Well, 20 or 30 years ago, the media, including papers like The Guardian, who've changed their editorial view, were very supportive of complementary medicine.
Okay.
And promoted it, often inappropriately. So I remember once, very early on in my career, getting a lady coming to see me who had cancer in her mouth.
Yeah.
And she was being treated with 3 litres of carrot juice a day, which was completely inappropriate. because mouth cancer needs surgery,
Yeah.
and early surgery is curative.
Mhm.
Sometimes very destructive, but curative. She hadn't been to see her GP. Her GP knew nothing about this.
Yes.
She had made a decision, and she'd colluded in that decision with an unscrupulous complementary practitioner
Yeah.
who had continued to treat her, in my view, unethically and inappropriately.
Hmm.
So I, with the lady's permission, wrote to her GP and pointed out that this was a very dangerous situation. I didn't see her again because she was coming to me for advice about what other complementary medicine I could use for the cancer, and I thought that was wrong, that she needed conventional medicine. Equally, I think when you go to your GP and you're getting a bit older, in your 60s and 70s, you can find yourself on about 15 different medicines
Yeah.
that may not be properly reviewed,
Hmm.
and one medicine may be causing a problem for another medicine, and if you sat down with a complementary practitioner and took a much more lifestyle-based approach to what was happening, you might be able to get rid of quite a lot of those medicines.
That's a very fascinating point to look at, and so the key is communication.
The key is communication between the doctor or practitioner and patient, and also the other key is communication between the practitioner, the complementary practitioner, and the doctor,
Yes.
so that the patient in the middle gets the best deal. Most mistakes in medicine happen generally
Yeah.
because of poor communication.
Yes.
So the vast majority of mistakes in conventional medicine are around poor communication, not understanding what's wrong with the patient, not listening to the patient's history properly, and not communicating their management to another professional.
Yeah, there are two questions. One I would like to ask from the patient's perspective, another from the practitioner perspective. Let me get to the patient perspective question. Is often research shows that patients don't talk to their conventional medicine practitioner or doctor about their complementary medicine usage because they believe that their doctors may discourage them, their doctors may not be interested, their doctors may not have a valuable opinion to guide a patient who is seeking complementary medicine approach. What's your view about this?
My view is that the vast majority of GPs, from all the surveys that have happened internationally, have want to know what their patients are doing,
Yeah.
and the majority of them are not dismissive of complementary medicine.
Okay, that's good to know.
But the media has created a situation where there's an apparent division,
Yeah,
which I think is usually not the case.
right.
Some are, of course, and you need to pick your doctor carefully.
Yeah,
But usually it's not the case. And by talking to your doctor about what you're considering doing, I think the patient almost all the time will make a better informed choice,
yeah,
and almost all the time the doctor will want to have some input into that choice, if at all possible. So I'm very much defending my conventional colleagues here and saying the perception of the man or woman in the street may be media-led and therefore not correct.
that's right. And, George, from the practitioner perspective, complementary medicine practitioners, obviously, they may not have the equal amount of training or the type of training that conventional medical doctors receive. So they often are shy or they hesitate to write to a GP if their patients are seeing a GP at the same time. What would be your advice for practitioners?
My advice would be that's a mistake. Very often the GP may not have the time to reply to a very detailed letter,
Yeah,
but the vast majority of GPs will take that seriously, particularly if the complementary practitioner may feel the patient's got a very serious medical problem that they shouldn't be dealing with. Or, for instance, you go and see an osteopath
yeah,
and he or she thinks that you may need an MRI scan because you may have a disc that's popped out and pressing on a nerve in your back.
Yeah.
Now, the GP needs to take that seriously, and the vast majority of GPs will take it seriously.
Yes.
Because the osteopath may have difficulty organising an MRI.
Yeah.
That may be much more the remit of the GP.
Yeah.
The herbal practitioner may think the patient has a very high blood pressure which isn't being controlled, or may be pre-diabetic.
Yeah.
And they need to send a letter to the GP. And the GP would be very foolish not to respond. This wouldn't at all be in the patient's interest.
Yes. Yeah. Yeah. So these are very important points for a consumer and also for practitioners, both conventional and complementary medicine practitioners to consumer.
There's one other point I wanted to make.
Yes.
In 1984 or 5, we had a colloquium at the Royal Society of Medicine, which is called Talking Health.
Mm-hmm.
And it brought complementary and conventional practitioners together to discuss exactly this, putting the patient at the centre of care.
Yes, absolutely.
And 30 years later,
yeah,
I think that's got even more importance.
Absolutely. Yeah, I think that's the important message, is that when it comes to taking charge of one's health, it is not about deciding which is better, which is worse, or who is good or who is bad, but it's about having a very honest, transparent, ethical communication and work as a team with conventional medical practitioners, complementary medicine practitioner. Ultimately, it is the patient who is at the center of it. So
yeah, precisely.
Yeah. So
they need to know when they're in danger.
Yeah.
And when they have time to make a choice.
Yeah.
And what their possibilities are.
Yeah. So this has been great, George, to hear your views, particularly because you have got immense experience both as a medical practitioner, having set up a complementary medicine centre, and as a researcher in primary care. I'm sure our listeners will be ever grateful for this piece of advice that came from you about patient-centered care. Thanks for being on my show.
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel good.
I hope this episode has given you a greater awareness on to looking for heavy metals in our food and how to detoxify. Do stay tuned to AYU-Well, and I'm going to be speaking again with you with another topic where we are going to look at the wisdom of Ayurveda and how to maintain our health in our modern day life. Thank you.